Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. My name is Bryce Patton, here with the wonderful Sid Roeder. How are you this morning, Sid?
You know, you always make my Saturday when you say wonderful co-host, so how could I not be wonderful?
Well, I'm trying to butter you up so you have that nice little smile when you do the intro.
Absolutely. You want me to talk about our sponsor?
I do want to. I want you to do it, not me. I want you to do it.
Yeah, it's my favorite thing. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and all the wonderful people that like to listen to us every Saturday morning. And we do so via this radio show, obviously. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can reach me personally at 435-512-6406.
And that's why I call you wonderful, because you do it, and you do it so wonderfully. All right, let's get to our guests today. We have Dr. Paul Schmidt, an internal medicine doctor, up at the Budge Clinic with us today. Welcome to the show, Paul.
Thank you.
Do you want me to call you doctor or Paul? Does it matter?
For today, Paul's fine. Yeah.
Paul works. Okay. Yeah. All right. Well, Paul, we were talking before this about your story and how you became a doctor and everything. You want to go into that and tell our audience about you and how you became a doctor?
Sure. I grew up in Logan. My grandfather was a vice president up here at Utah State, so my mom grew up, so she's a local as well. And I went to Logan High and went to Utah State. I'm an Aggie, and then I went to medical school, and I went to the Navy for residency, so I spent some time in Virginia and then in California with the Jets there in California with the Navy pilots, and we've been back here since 2016.
And that, of course, raises the question, what's your specialty?
I am board certified in internal medicine, but I'm also board certified in obesity medicine.
And why did you go into internal medicine and then obesity as well?
I really like the internal medicine just because it is wide-ranging. I used to look into the specialties and said that was too narrow for me. I like knowing a little bit about everything, and so it was really good just to be able to help people in lots of different ways and be their source. Obviously, we have lots of help up there at Budge Clinic and in the Valley with lots of different good specialties, but it is really awesome just to be able to take care of most things ourselves and be a one-point contact there too. So internal medicine is primary care for adults, and I really like just being able to sit down and meet with people one-on-one and come up with plans for them and how make themselves and their lives just a little bit better. With so much obesity that we deal with here in this country, I thought obesity medicine fit really nicely. I was seeing all these people with diabetes and high blood pressure and high cholesterol and arthritis, and I thought obesity just kind of fit nicely with treating one in the middle there too. Lots of people say they like to get to the root cause of things, and I felt like obesity really got to the bottom of the root problem everyone was dealing with and just needed help. And so I've just working with them, helping work multiple medical problems at the same time instead of just working at one at a time.
That's awesome. So I'm curious, you said internal medicine, and that's with adults. Is that the only difference between internal medicine and then a family practice doctor? Is there other things in there?
We have some great family practice doctors here in town. The main difference is they spend their residency dealing with both adults and children, and internal medicine really just does adult diseases. And so we have a little bit more emphasis on diseases of older age. So we tend to get a lot of those people over 65 in our clinic, although family practice do a lot of that as well. But if someone's a little bit more complicated, sometimes the family practice docs will send them our way.
Oh, that's fantastic. So I'm curious, going into obesity, what are some of the big causes that you see is causing obesity in our country?
Right. So, and a lot of these things are good. We spend a lot less time doing housework. So a lot of the products that come with vacuum cleaners and cleaners are a lot better. So compared to the 1950s, we do a lot less housework, and so we just spend a lot more time sitting. We have jobs with computers and smartphones that can do a lot of stuff for us. We can order food directly to our armchair almost these days. So a lot of the things are, we're creatures of habit, and we like to do things a certain way, and so being able to just make our life really easy. It doesn't seem like it these days, but actually the amount of time we have to spend earning money for food is a lot less, and so the price per calorie is much lower, and so it's just a lot easier to get a lot of calories into us at one time. And just like our grandmas, the food companies like to make things that are tasty that we'll buy, and so they put a lot of salt and fat and sugar and things, and not that those things are necessarily bad, but they do make us crave them and want to get a lot more of them in us, and it's a lot easier to get those things into us and kind of exceed what our body actually needs.
I'm a little curious on how our Cache Valley is doing in comparison to the national average. Do you know the numbers there?
I haven't looked at the numbers recently, but I do believe actually Cache Valley is one of the better ones. This may not have been the best place to come practice obesity medicine, but we do have plenty of people that are in need of our help. And Utah is 49th or 48th out of there too. So Utah actually does a lot better than compared to a lot of the places.
Oh, that's fantastic. So if somebody's worried about that and they want to come see you, kind of what's the process that you go from maybe the initial assessment to working out a game plan to help with that problem?
Sure. So we'd sit down, and every plan is personalized. So we see what they've already done and tried so far. It doesn't make any sense if you've tried something 6 times to do things. A lot of people get accused of, with obesity, that they're lazy people, and I know the majority of my patients that I work with that have obesity are not lazy. They've tried everything under the sun and really just need to sit down and focus their efforts and find a good way to do it. So we sit down, find out what they've done. We'll sometimes review medications. Some medicines do have weight gain as side effects, and so if they've seen another specialty, well, I'm happy to sit down with their other specialists and see if we can come up with something else to help them. And we make an exercise routine. I can work out with some people some basic dietary things. However, we have some great nutritionists and dietitians up there at Budge Clinic as well that can work with people on things too. So we try and make it a team approach. We have physical therapists. If chronic pain is what's keeping you from moving, we work out a plan on all those things. So it's really just a comprehensive evaluation and see what they've done, and we can work with people on making lifestyle changes, and we work with them and talking with either stopping or starting medications that might be helpful for them.
So it sounds pretty extensive, and I can imagine that's not necessarily done with one visit. We are coming up on our first break here, though, so maybe I should give you a chance Paul, to mention your contact information and where you're located in case somebody's interested to meet with you.
Sure. We're at the Budge Clinic. They're attached to the hospital at Logan Regional Hospital. Best phone number to reach us is at 435-716-1980.
Thank you. This is the Senior Moment Show. Again, let me mention our sponsor, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. Again, this is the Senior Moment Show. We're going to take a short break. Stay tuned. We'll be right back.
Are you tired of feeling unwell and not knowing why? At Next Level Health and Wellness, we hear you. We specialize in uncovering the root causes of your discomfort, whether it's gut health, hormone imbalances, or emotional and mental blocks. With personalized plans, advanced lab testing, and evidence-based holistic nutrition practices, we guide you toward lasting health and wholeness. Awaken your healing potential with a team that listens, understands, and supports you wherever you are. Visit nextlevelhw.com to start your journey to feeling better today.
Getting around your home should be easy and safe. At RT Med Mobile, they provide wheelchairs, stair lifts, ramps, and electric lift chairs to help seniors maintain independence and comfort. Their friendly team offers free in-home consultations to find the perfect solution for you or your loved one. Locally owned and here to help. Call 435-260-6171 today. RT Med Mobile, because your mobility matters.
You know, now that all the kids are gone, There's more house than we can handle.
This whole back isn't quite what it used to be.
That's not the only thing. But anyway, the kids say, put it online.
Yeah, but I can hardly operate the Facebook, let alone list our house.
Hi, this is Sid Roeder with Achievement Realty. There are big advantages when working with a realtor, and I have special experience working with seniors. Let me earn your trust. Call me at 512-6406. Then list it, sell it, and move on.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
And welcome back to the Senior Moment Show. My name is Bryce Patton here with Sid Roeder, as well as our guest, Dr. Paul Schmidt, up there at the Butch Clinic, one of the internal medicine doctors. And he's been telling us all about weight loss and obesity, and that Utah is actually doing pretty darn good, which is fantastic. Now, Sid brought up before the break that this is an ongoing process. When you start somebody on the weight loss journey, how long until you start seeing results in general? Can you even put a time frame on that?
Yes, good question. I would say, obviously, we do temper expectations and kind of say this is what we expect based on the treatment that you've picked, and we go over what the expected weight loss would be. We work with people. We're hoping to get some results within 1 to 2 months. I do tell people that if you're 50 or 60 years old, you've probably spent a good chunk of that with excess weight, and it's not going to come off overnight. You spend a long time building that up, and we have to reverse some of that as well. Some of that damage unfortunately may be permanent, so we still may be dealing with some diabetes or some arthritis, but we work with people to find a better way forward. It really depends on the type of treatment, how long we would expect to do it. I try to meet with people, every 1 to 3 months, but some people it makes sense to meet with them weekly or every 2 weeks, depending on what we're doing and making goals and setting different expectations. I do have a quick story. I have someone that I worked with in California came to me. She had set a goal to lose 80 pounds, and she was super frustrated because she'd only lost 60. But in the process of doing all this, she had decided to take up competitive bike riding, and so she was doing these big races there too. And so we kind of talked to her about how far could you go on your bike before you started this weight loss journey. And she said, I could barely go downhill 1 block before I was out of breath. And now she's doing these big bike races there. And so we talked to her and said, you've come a long way. Your life is so much better. Maybe we don't need to set a weight goal, and we look at some of the other goals other than a specific weight number. People like to use the body mass index, which is good for predicting certain things in the population, but it's not good for predicting specific complications that someone might have. So we can talk with people and say, hey, what are your actual goals? What is your weight keeping you from doing? And let's find a way to get you there. Some people just say, I just want to play on the ground with the grandkids. And we say, well, let's get you on the ground with the grandkids and find a way. And if that's, 15 pounds, if that's all we need to do to get you there, let's do that. If our weight's more like 50 or 60, maybe we get you in contact with medications, or even sometimes we'll send you down to a surgeon for weight loss surgery. So we really just have to personalize it and look for ways to do that and make sure that our goal is not to get someone on the cover of a fitness magazine, but really to get it so that the weight is no longer affecting their quality of life the way that's been bothering them.
That's actually one question that I was wondering about. When people come to you, do you find that they come to you to be healthier, or is it more a visual thing that bothers them?
I think it depends. I think most of our patients, especially our senior patients, really just want to be healthier. They just want more time with the grandkids, or to be able to travel and to breathe better and move better. And so but sometimes it is appearance, and some people, again, have looked up on the internet what their ideal body weight should be, and they go for that too. But some studies show even as little as 5 or 10% reverses a lot of the problems that diabetes have. So really, we can even some small changes in the right direction make a big difference for people.
I'm really glad you brought up the body mass index, because I got super frustrated because I looked at that and it said I'm super obese. but yet I go hiking every weekend, and so I'm really glad you said that. But you also mentioned something that you look at. You were talking about nutrition and different things, and you talked about medicine and maybe surgery. Do you recommend those very often, or is that just a case-by-case basis?
Really case-by-case basis. We don't have a surgeon up here, so people are a little bit hesitant to travel. So surgery, but if their goal is really 50% of their weight, really surgery is going to be your best option. So it really depends on what our overall goal is and what we're looking to achieve. Most of the time, we really just want to improve your fitness and make you a better version of yourself, and so not necessarily are we sending everybody to get surgery. Medications can often be helpful, especially when someone's transitioning. Hunger is a big thing. There's a relatively new term called food noise, where you just kind of always think about it, and a lot of people didn't really know what that is until we started some of these medicines, and it's gone, and they're not thinking about food when their next meal is coming from. They're no longer hobbits looking for second breakfast all the time, and they're just looking for, they can actually focus on other things other than food as well. And if they're dealing with, sometimes we use food to treat anxiety or fatigue, and if we can find ways around that, working on improving sleep and fitness and overall health, sometimes we don't necessarily need to find a specific goal or a body mass index for people.
And when you were mentioning diabetes before, I'm just a little curious. So do you find ways to reverse that? I mean, depending, of course, what type of diabetes and how long it's been going on, but do you have ways to reverse that and get people away from pre-diabetic?
Yeah, and so pre-diabetes is the best time to step in and do things if we can, but we are often able to get people off certain medicines for diabetes if we can and get them healthier. Sometimes medicines are still a part of the plan regarding, and it depends on how long they've had it, essentially there too. So if we can work with them and make some improvements, our goal is, I'm always happy to take someone off of medicine. My goal is not to throw people on as much as I can.
So you mentioned earlier about obesity and how as you're changing this, you can fix maybe diabetes or different things. Do you find that when people lose weight, a lot of their other issues just go away, or are you still having to treat a lot of those things on the internal medicine side?
Yeah, good question. So a lot of times things get better. We still have genetics and age changes. Some people still have high blood pressure, even with the weight loss. Sometimes the cholesterol is still a little bit high. We still have the genetics working against us, and we're still, if you're 65 and you were really good shape in 20, you still have 45 years of damage for arthritis. You also have difficulties with ongoing things with the genes. So we're often able to do it, but I would tell people, if you're more fit, oftentimes we may still need to keep one medicine on for blood pressure, but we may not need the 3 medicines that you're on before.
That's great. We're almost at the end of our second segment. So one quick question, is it ever too late?
I would not think it's too late. We may not get you down to, a size 2 dress if that's what you're looking for, but we may be able to improve your life and improve your fitness. And there's always room for improvement. And sometimes if we just maintain weight, that's better. If someone has been gaining weight over the years, sometimes we can reverse the weight gain and keep it steady, and that's still better off for people.
Thank you so much. This is the Senior Moment Show. Again, let me mention our sponsor, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. We're the Senior Moment Show. We're going to take a short break. Stay tuned. We'll be right back.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a pre-arranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts pre-arranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most. Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
This is Oliver with Cache Valley Pharmacy and owner of Focus Pharmacology, Cache Valley's own premier supplement line. With the beginning of the new year and everyone's health and pocketbooks in focus, we are offering buy one, get one free on all our locally made high-quality supplements. With already competitive cash pricing, along with our state-of-the-art lab for all your compound needs, why go anywhere else? Start your new year off right and come to Cache Valley Pharmacy today. Cache Valley Pharmacy, keeping it local. Online at CacheValleyPharmacy.com.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
And welcome back to the Senior Moments Show. My name is Bryce Patton here with Sid Roeder, and we've been speaking all things obesity with Dr. Paul Schmidt up there at the Butch Clinic. He's an internal medicine as well as a board-certified obesity doctor. Is that what they call it? Okay. Well, so we were talking over the break, and we were just wondering how much with obesity and different things, how much does the mental side of things come in? Your mental health, and are you able to treat that if that is part of it, or do you have the resources for that?
Sure, yes. A lot of people have put a lot of internalized shame about things. They've been called lazy their whole life. And as we said before, I don't think they're lazy, but a lot of times people have internalized that. And sometimes we need to peel back the layers, and they've been verbally and physically abused because of weight problems. And so we work with people, and a lot of times I can help with people and come up with medication things. A few weeks ago, you had Angela Martinez on here, and she works 2 hallways down from us, and she and her colleague, Dr. Wigan, have been really helpful at being able to get people in to help peel back some of these difficulties they've had with years of dealing with these changes that they've had with their weight.
So do you refer that out, or do you have therapists in-house? How does that work?
Yeah, so we have some therapists, and we'll just work with people based on their insurance and personal preferences. We can get people usually where they need to go. We can do some medications because we are internal medicine physicians, and we do top to bottom care. So we can do some medications for mental health, but if we do need phone a friend, we can get therapists and psychiatrists and help us with some medication changes as well.
All right. Well, so Sid asked earlier if it's ever too late, but I want to know if people want to start today, what are some tips or things that we should all be doing so we can stay healthier longer as much as possible?
Sure. And I just want to point out real quick that it is Obesity Recognition Week. So just to be aware, so there's lots of resources out there on the web this week if you're interested. Some things I would say is maybe just take a checklist or evaluation of where you're at. If you're getting 1,000 steps a day, sometimes that 10,000 step goal that often people recommend sounds really far away. So maybe you start with 1,500 steps instead of going for 10,000. If you don't like vegetables, but you heard that's always vegetable, maybe find one vegetable that you can like and find a way to prepare it. And if you need to put butter and salt on it to make you eat your vegetable, then let's start there and gradually increase up there. If you need to put ranch dressing on your carrot sticks to eat your carrots, let's start there. So I would just say take a general accounting and maybe take one small step to work that way. We all know that exercise, sleep, and diet with Mediterranean style has the best evidence are very helpful. And so if you can start making a goal in one of those things or 2 of those things, and we can work with you, of course, in the clinic if you're having difficulty with any of those goals.
I actually have a truth or false question for you. I don't know. Lately on my thing, it's popped up that the sequence of how you eat makes a difference. Veggies first, and then do you agree with that?
So again, I'd personalize it. If you're not eating your vegetables because you're full of other things, I think it makes sense to eat the vegetables first, but I don't think in the grand scheme of things, I wouldn't personally shame someone or have someone switch if they have a set style.
So that means I can have my ice cream first as long as I have my carrots?
I knew that was coming.
Oh, I can't wait to tell my wife. I'm so excited. What about movement, right? What are good exercises for some of our seniors that may be wanting to get up and move more?
Yeah, so walking would probably be the safest. Obviously, it gets cold and icy around here, so that can be a problem. But we would say, do what you can, and we have some really big box stores around here too. So if you grab your shopping cart and go take 2 laps around the outside of the store before you put anything in your cart, I think that would be a good place to start. All the shoe company apps have some basic things. There's lots of different exercise apps, and there's one called the 7-Minute Workout that 7 different people have different apps for, and those would be, if you just want someone to tell you, this is what you want me to do, that's what I would send people to try and find something. The best exercise is one that you don't hate doing and you can have access to.
That's fantastic. Well, we're getting close, but I want to know, off the top of your head, do you have a favorite success story when it comes to somebody who's been struggling with obesity throughout their life?
Yes. So yeah, I do have a couple of patients there too who've, they just felt really down, depressed. Everyone had called them lazy. They'd been, verbally abused their whole life and told they were, have been called all kinds of horrible names because of their weight, and they were starting from literally zero, but they just said, I'm just going to do something. I need to make a change. And so we've worked with people, have people who, again, they were doing about 1,500 steps a day, and we said, let's do 2,000 steps. You're doing 5 minutes a day, let's do 6 minutes a day on exercise, and do that for a week, and then let's do 7 minutes a day. And so we've had some people make some really good success and get people off their medication and make some big changes and save people money in the process because they don't have to pay for so many pills. And, we've had some really nice, some sex stories that, again, they might not be, size 2 on their dresses. They might not be on a fitness magazine, but they feel so much better. They're enjoying life. And I think that's the most important thing we can get for people.
I think that's wonderful. Thank you so much. And because we've got a few seconds left, would you share your phone number one more time?
Sure. We're at the Internal Medicine in the Budge Clinic. Phone number is 435-716-1980.
Thank you so much for coming in and enlightening us on what you do and how you can help people. This is the Senior Moment Show. Sadly, we are at the end of our time here for today. It was great to have you here and learn a lot of things about internal medicine and how we can get helped. We are at the end of our show. For our listeners, we hope you tune in again next week.